My 4-year-old daughter recently started complaining that her throat hurts.
Mommy, my throat hurts really badly.
It was so bad that she would cry at night. After several months, we figured out it was acid reflux. But now what? Is medication the only answer?
Well, welcome Natalie to the show. Thank you for coming on. Wow, it took 7 months to finally figure it out. And that kind of what shows, you know, with kids, sometimes if they can't really verbalize what's going on, it can be pretty confusing. So let me show you what happens in your body, whether you're 4 or 40 or 45 if you had too much pizza last night like me.
How about 49?
Yeah? Is that your little brother or something? No, but I love you, man. I hope I look as good as you. I said I hope I look as good as you when I'm your age. So anyways, imagine this is your stomach and your esophagus. Down here, your stomach has all the stomach acid, and then your swallowing tube, the esophagus, your mouth is up here, and at the bottom of the esophagus, there's a little ring muscle called the lower esophageal sphincter, and normally it squeezes shut to keep all that stomach contents down in there, keep it from splashing up. When you swallow food, it opens up briefly, then closes back up, so nothing refluxes back up in there. But if you have reflux, this ring is too loose, and all that stomach acid.
Whoa! Now that's some reflux!
And anybody with heartburn.
I hope that's not what she's going through.
That looks like that would cause a sore throat to me.
Yeah. You know, anybody with heartburn sees this and goes, yeah, that's how it feels. You get that burning feeling, maybe down here or even up in your throat.
Yeah.
You can, if you're laying down, suddenly you've got a mouthful of acid and you're trying to sleep, and that can be a real problem. It can even get over into your vocal cords and cause hoarseness, chronic cough,
And
things like
she's
that.
constantly clearing her throat, and I'm sure it's because of the acid coming up a little bit.
Irritating.
To push it back down. Yeah.
So I recommend patients, you know, at any age, if you have a problem with this, certainly work with your doctor, because it's a problem you don't want to let go without treatment. Sometimes there's over-the-counter medications, prescription medications. Certain foods can help. Things like yogurt, dried figs, and pineapple have an enzyme called bromelain. And that actually helps neutralize acid, so that can help reflux. And then there's a few things you want to avoid. And oftentimes you'll learn these by trial and error. Orange juice is a big one that can kind of lead to more stomach acid, chocolate, onions, and a big one for a lot of people is tomato sauce.
I think hers is that, yeah.
Things with pizza.
Yeah.
People with reflux will want to eat smaller meals. If you think of that soda bottle, the less full it is, the less likely all that acid is going to leak up, right?
Oh, I
so
see.
if you eat smaller meals, maybe half as much, twice as often,
Right, okay.
and you'll feel a lot better, and try to stay upright after a meal.
Okay, thank you so much.